Hello, today's Thursday, October 29th, 2020. This is Dr. Rhonda Johnson. Today I'm talking about preparing for the third surge and the importance of having an emergency supply kit on hand. Well, we know that the third surge is underway. In 49 out of 50 states, the cases are increasing. Here in home yesterday in Allegheny County, saw its second highest day of overall positivity rate of 12.6%, and it had been 6.8% since March. So cases are on the rise all over the country. So you may want to have some emergency supplies on hand, and let's just call it the COVID-19 emergency kit. And if you have a family, you should have enough supplies for the entire family. So I'm going to run through some things you may already have at home. It's just organizing them so that they'll be ready for you when you need them. A thermometer is number one. If you have children, you may want a child-friendly version that can scan their foreheads. 2, a pulse oximeter. That's a device that goes on your finger. It measures your blood oxygen levels. It can be real important once people start having pulmonary symptoms of COVID-19. You can get these from online retailers or a local pharmacy. A cheap $20 some version is more than adequate. Number 3, over-the-counter meds such as fever reducers, cough suppressants. So you can use both acetaminophen and ibuprofen. And if you have children, make sure you have the child-friendly versions of the fever reduction medicine for them. Healthy, ready-to-eat food. Keep it simple. You might not have an appetite. You may lose your smell and sense of taste, but you're still going to need some nourishment when you're sick. Number 5, have broth, water, tea, and non-alcoholic beverages available, because one of the most important things you can do when you have COVID-19 is stay well hydrated, even if you don't feel up to eating. Number 6, you need some electrolyte solutions. Pedialyte, if you have children, Gatorade, or other oral rehydration solutions if for adults. You can buy these at many pharmacies or some health food stores, again, online retailers, or the baby section of your grocery store. Number 7, you're going to need to have disposable eating supplies like plates, utensils, cups, because you can't share anything like eating, drinking, bathing linens, sleeping linens. You can't share anything. Number 8, you need sufficient soap, hand sanitizer, and bleach to keep surfaces clean. Use the bleach in the bathroom, around the toilets, the faucets, especially because the COVID-19 virus can be excreted in the stools for up to 3 months. And have enough laundry detergent to wash clothes and linens on the hot setting frequently. Have disinfecting wipes, paper towels, and soap by the bedside. Number 9, you'll need some single-use disposable gloves on hand, and use them to clean behind people with COVID or any interaction with your ill family member. Use disposable gloves. When you take them off, be careful. Only touch the inside when you're removing them. And always put everything in a plastic bag and just tie it tightly, dispose of it. And you may want to have first aid essentials for minor injuries if someone falls. And if you've got babies, parents, don't forget about the diapers. And then masks. You need at least 2 masks per person in a household with COVID-19. And if you have disposable masks, that's good, because you can change the masks frequently. Now, other things you may want to consider is having an emergency contact list, family, friends, your doctors, the local public health department, etc. And if you live alone, please arrange to have somebody check on you regularly. You may also want to write down passwords, because you can have what's called the foggy brain, and you might not remember your passwords, so it won't hurt to write them down. That might come in handy. And then planning. Plan your sick area. Do you have a room where the sick person can be isolated, hopefully a room with a window and a small fan to get those germs out of the room so that you're not constantly rebreathing these COVID-19 viral particles. So that's it, folks. I may have forgotten something. One thing I know I forgot to say is your medication. Have a 2-week supply of any prescription medications that you might need on hand, because you're going to be in quarantine for at least 14 days. And if I forgot anything, blame it on the head, not the heart. This is Dr. Rhonda Johnson. As always, my views are my own. Stay safe. And remember, the best infection of COVID-19 is the one that gets prevented. Have a blessed day.